Okay, good day, class. So, for this time, we're going to tackle your lesson 13, the gastrointestinal viruses. So, under gastrointestinal viruses, class, there are three families of viruses that we would discuss. The first one is the family Rheoviridae. Under the family Rheoviridae, there are a total of five genuses. The genus Orthorheovirus, Cultivirus, Rotavirus, Orbivirus, and Rheovirus. Then the second family is the family Caliciviridae. Under Caliciviridae, we have the Norwalk viruses, the Sapporoviruses. Now, under Sapporoviruses are the Sapporo-like viruses. Then we have genus Nevovirus. Under genus Nevovirus class, we have the bovine enteric viruses. Then we have your genus Lagovirus. Under genus Lagovirus, we have your rabbit hemorrhagic disease virus. Then we also have the genus Vesivirus. This is a vesicular virus, exanthem virus of the swine, and the feline calicivirus. Then we have also under it the marine viruses found in pinnipeds, whales, and fish. Then the last family is the family Astroviridae. And under family Astroviridae, we have the genus Mamastrovirus. So those are the different families and genuses and even virus under them class, under the gastrointestinal viruses. So let's start with the family Rheoviridae. Now, of all the five genuses listed under the family Rheoviridae, only four are able to infect humans. The genus Orthorheovirus, the Rota, Colti, and Orbivirus. Then the genera are subdivided class. So yung four genuses, yung four yan, yung Orthorheo, Rota, Colti, and Orbi are known to infect humans. And they are subdivided class into two subfamilies. We have the subfamily Spina Rheovirinae, which would contain viruses with a large spikers at the 12 vertices on the particle. So under Spina Rheovirinae, we have the genus Orthorheovirus and the genus Cultivirus. Then the second subfamily class is the Pseudorheovirinae. It appears more smooth, lacking the large surface projection. So si Spina Rheoviridae nyo class, sa surface, sa surface nila, in their surface, they have large spikes, while the Pseudorheovirinae are smooth class, usually absent. The spikes are absent or the surface projection are absent. Now, under Pseudorheovirinae, we have the genus Rotavirus. Now, the genus Rotavirus class has eight species. Eight species. Rotavirus A, B, C, D, E, F, G, and H. Now, take note, class, that only rotaviruses species A, B, and C can infect humans. Then we have the genus Orbivirus, also under Pseudorheovirinae. Now let's take a look at the properties of your Rheoviridae. So the virion class, the virus would be icosahedral, 60 to 80 nanometer in diameter, and they have a double capsid shell. The composition, it is that RNA, it's 15% RNA, protein is 85%. The genome class is a double-stranded RNA, linear, segmented, 10 to 12 segments, and has a total genome size of 16 to 27 kbp. Then the proteins class, take note, they have 9 structural protein, and the core would contain several enzymes. Envelope is none, so this is a non-envelope virus. It has a so-called transient pseudo-envelope present during rotavirus particle morphogenesis. Then replication would occur in the cytoplasm. Virions are not completely uncoated. Then outstanding characteristic class, genetic reassortment occurs readily. The rotaviruses class, take note, are the major cause of infantile diarrhea. Then we have reoviruses, which are good models for molecular study of viral pathogenesis. Now let's take a look at the replication of your rotavirus class. So rotavirus outer capsid spike, yung BF4 protein niya, would bind to the receptor. So yung way of attaching ng rotavirus nucleus, itong VP4, the VP4 class would attach to the receptor. Ano yung receptor class? Sialic acid containing glycoprotein. So once it's attached class, it would be followed by a conformational change, removal of outer layer, and penetration of the virus into the target cell. Now, inside the target cell class, it would uncoat. So, mag-uncoat siya, matatanggal yung capsid niya. Then, viral RNA-dependent RNA polymerase directs the transcription of viral messenger RNA, followed by synthesis of viral protein, by genome replication, and by using the negative strand RNA of the double-stranded RNA genome. Then rotavirus assembles by associating its core with a non-structural protein, NSP4, and acquiring VP7 and a membrane budding from the endoplasmic reticulum. Then the virus eventually loses the membrane in the ER and is released upon cell lysis. Now, the rotavirus class belongs to the family Rheoviridae. The genome of rotavirus is unique in the sense that they have 11 segments. So, they have 11 segments class. So, if you take a look at this electrophoresis, you would be able to see here 11 segments of double-stranded RNA. So, the 11 segments would consist of VP1, 2, 3, 4, NSP1, VP6, NSP2, 3, VP7, and the 10th segment is NSP4, and the 11th is NSP56. Now, rotaviruses class are classified into 7 groups, A to G, based on the internal capsid protein VP6. Human infections are predominantly caused by group A and less commonly by group B or C. So again, class human infections class are caused by group A. So majority of human infection of rotavirus is caused by rotavirus A, while less commonly by group B or group C. Now, let me discuss class yung mga proteins nila. So, if you take a look at this icon, itong figure na to, figure B, you would see two proteins, VP4 and VP7. Now, take note class that VP4 is the spike protein. So, yan yung nag-a-attach dun sa sialic acid containing receptor. Then, yung VP6 naman class, VP7 rather, the VP7 is the outer capsid layer. Then itong figure 6 class would show a cross-section. Cross-section, so nakikita mo yung hiwa sa gitna, yung center ng virus class. Now here you would see showing the inner VP6. So this is the inner protein VP6 and the VP2. So ito yung mga inner proteins niya, VP6 and VP2. Then we also have yung letter D class, the figure letter D would show a double-stranded RNA genome. So this is a double-stranded RNA genome which segments as represented by inverted conical spiral. So yan yung mga segmentations niya. Yung mga conical spirals na yan. Now, the pathogenesis class is that your rotavirus would infect cells in the villi of the small intestine, wherein the gastric and colonic mucosa are spared. Then they would multiply in the cytoplasm of the enterocytes and damage their transport mechanism. So kaya siya kanina class, di ba, nagmumultiply siya, sabi dun sa replication, they would multiply in the endoplasmic reticulum. And your endoplasmic reticulum class is responsible for transporting certain proteins. So what the rotaviruses do is that they destroy this itong transport mechanisms nila. Then damaged cells may slough into the lumen of the intestine and release large quantities of virus, which would appear in the stool up to 1,000 particles per gram of feces. Then viral excretion would usually last from 2 to 12 days in otherwise healthy patients. So ganun katagal class. The virus would continuously be excreted in normal humans from 2 to 12 days, but may be prolonged class in those with poor nutrition and immunocompromised patients. Diarrhea class caused by rotavirus may also be due to impaired sodium and glucose absorption, as damaged cells on the villi are replaced by non-absorbing immature crypt cells. If familiar kayo class, your villi your villi is responsible for absorbing nutrients sa stomach nyo. Now, what happens is that the virus has destroyed this villi. Kapag na-damage sila, na-injured sila, they would be replaced by so-called immature crypt cells. Itong mga immature crypt cells na to, these immature crypt cells are not able to absorb nutrients, leading to impaired sodium and glucose levels. It may take from 3 to 8 weeks for normal function to be restored. Now, what are the clinical findings, class? So, take note, class, rotaviruses would cause the major portion of diarrheal disease in infants and children worldwide, but rarely it would affect adults. So, typical symptoms, class, would include watery diarrhea, fever, abdominal pain, and vomiting, leading to dehydration. In infants and children, severe loss of electrolytes and fluids may be fatal unless treated. Lab diagnosis, class, immunologic detection of antigen with enzyme immunoassay methods or virion RNA bar RT-PCR. Then we have also direct examination of the specimen by electron microscopy could also be done in research setting. Treatment, class, is like all other diarrheas, class. You need to treat the loss of water and electrolytes that could lead to dehydration, acidosis, shock, and death. So whenever you are suffering from diarrhea, class, the first thing you need to do is to treat the lack of your electrolytes, because of lack of water and electrolytes, class, could be the one that could cause death. Management would consist of replacement of fluid and restoration of electrolyte balance, either intravenously or orally as feasible. Rotavirus vaccine, class, should not be given to infants age 15 and above due to the lack of availability of safety data. While the vaccine is safe, mild problems such as temporary diarrhea or vomiting may occur. In addition, 1 in 20,000 to 1 in 100,000 infants may have intussusception. Intussusception, class, is a bowel blockage with rotavirus vaccine. So you're not allowed to give vaccine, class, to rotavirus to infants age 15. So 1 year old in 3 months, class, bawal sila. So they need to be at least 1 year and 4 months or 1 year and a half for you to be able to give them the rotavirus vaccine. Now let's go to the genus Rheovirus. So the virus of this genus, class, which have been studied mostly throughout by molecular biologists, are not known to cause human disease. Rheoviruses, class, would contain a hemagglutinin for human group O or bovine erythrocytes. Rheoviruses, class, would cause many inapparent infection because of most people have serum antibodies by early adulthood. So hindi siya, it's mostly asymptomatic infections, class, whenever you encounter this. The reason, class, is by the time you reach early adulthood, you already have antibodies against it. Now, human voluntary studies have failed to demonstrate a clear cause and effect relationship of reovirus to human illness. In inoculated volunteers, reovirus is recovered far more readily from feces than from the nose or throat. Then we have the genus Orbivirus. They commonly infect insects, and many are transmitted by insects to vertebrates. So this is a vector-transmitted virus class. About 100 serotypes of Orbivirus are known. None of these viruses would cause serious clinical disease in humans, but they may cause mild fever. Serious animal pathogens would include blue tongue virus of sheep and the African horse sickness virus. Antibodies to orbivirus are found in many vertebrates, including humans. The replicative cycle is similar to that of reovirus. Orbiviruses are sensitive to low pH, so sensitive sila to acid, in contrast with the general stability of other reoviruses. Then we have the genus Coltivirus. So this would include the Colorado tick fever virus. So if it's tick fever class, they are usually transmitted by ticks, able to infect human, and found in the southwestern United States and could cause fever, chills, headache, photophobia, myalgia, arthralgia, lethargy, and even rash. Systemic symptoms would occur class in infected patients. And in some cases, class, the virus infection can lead to encephalitis or meningitis. Now let's go to the second family class, the family Calliciviridae. So they are similar to picornaviruses but are slightly larger. So the virion class is icosahedral, 27 to 40 nanometer. They have a cup-like depression on the capsid surface. Single-stranded RNA, linear, positive sense, non-segmented, 7.4 to 8.3 kilobytes in size, and would contain a genome-linked protein or the VPG. Now, the proteins class are polypeptides cleaved from a precursor polyprotein. Capsid is composed of a single protein. It is non-enveloped and replication would occur in the cytoplasm. Outstanding characteristic class, we have the noroviruses, which are the major cause of non-bacterial epidemic gastroenteritis. The human viruses class are non-culturable. Let's start with the noroviruses class. Now, the noroviruses class, the genus noroviruses, are also known as your Norwalk viruses. They are the most important cause of epidemic viral gastroenteritis in adults. Epidemic non-bacterial gastroenteritis is characterized by number one, absence of bacterial pathogen. So you have a gastroenteritis class, but you are negative in bacterial stool culture. So no bacterial pathogen present. Then you have gastroenteritis with rapid onset and recovery and relatively mild systemic signs. An epidemiological pattern of a highly communicable disease that would spread rapidly with no particular predilection in terms of age or geography. So this is more of a random gastroenteritis class. Wala siyang pattern na fina-follow. It doesn't affect a certain group of people. It's just a random gastroenteritis. So clinical findings class. So the norovirus or the Norwalk virus has an incubation period of 24 to 48 hours. The onset is rapid and the clinical course is brief, lasting 12 to 60 hours. Symptoms would include diarrhea, nausea, vomiting, low-grade fever, abdominal cramps, headache, and malaise. The illness can be incapacitating during the symptomatic phase, but hospitalization is rarely required. Norovirus infections are more likely to induce vomiting than those with Sapporo-like viruses. Dehydration is the most common complication in young and elderly individuals. For the lab diagnosis class, RT-PCR is the widely used technique for detecting calicivirus in feces and vomitus, and as well as environmental samples like food and water. EM or electron microscopy could also detect calicivirus. They could also be identified, noroviruses could also be identified by immune electron microscopy. ELISA immunoassays based on recombinant virus-like particles can detect antibody responses. And control class. So treatment is based on symptoms. So treatment is you would just be treating the symptoms class. The low infectious dose permits efficient transmission of the virus. Effective hand washing class is probably the most important method of preventing norovirus infection. Because of the infectious nature of the stools, care should be taken in their disposal. No vaccine available. Then we have the family astroviruses class. So our astroviruses are about 28 to 30 nanometer in diameter, and they exhibit a distinctive star-like morphology in the electron microscopy. They contain single-stranded positive sense RNA, 6.4 to 7.4 kb in size. The family Astroviridae contains two genera. All human viruses are classified in the Mamastrovirus genus. Astroviruses would cause diarrheal illness and may be shed in extraordinarily large quantities in feces. The viruses are transmitted by the fecal oral route through contaminated food or water, person to person contact, or contaminated surface. They are recognized as pathogens for infants and children, elderly institutional patients, and immunocompromised person. Detection class can be achieved with antigen detection, or RT-PCR methods. Then we have the so-called enteric adenoviruses and candidate viruses. So when you say candidate viruses class, they could possibly belong as gastrointestinal viruses. So this would include adenoviruses serotype 40, 41, and even 38. These adenoviruses would infect infants aged less than 2 years old. They are transmitted by fecal oral route, and the incubation period is 8 to 10 days. And the symptoms of gastroenteritis last for 5 to 12 days. The diagnosis can be done by antigen detection, PCR, virus isolation, and serology. Treatment and prevention strategies are similar to those other diarrheal viruses. Other agents that have been associated class would include coronavirus-like agents, toroviruses, and some group A Coxsackie viruses. So these are the test class. So take note of this. So for every group of viruses, there is their biological appearance. So do take note of them. There's also the pathogenic site. When you say pathogenic site, basically the site of infection. So the site of infection is mostly on the gastrointestinal tract class, the duodenum, the jejunum. Then the epidemiology. So take note of the epidemicity, the seasonality, the ages primarily affected, the method of transmission, and the major diagnostic tests. So do memorize this table class. This will definitely come out in your quiz and exam. So that ends your gastrointestinal viruses. Thank you.